Atherosclerosis Prevention Part 2. Part 1 in this series discussed the risk factors: hypertension, cholesterol, obesity, and diet. In this Part 2, we will discuss other risk factors and their prevention. Physical inactivity. Physical inactivity is increasing in low and middle income areas of the world, witnessing a shift from physically demanding agriculture based work to largely sedentary service industry based and office based work, which are better paying. A change to mechanized transportation accompanies this work shift. Current recommendation is for moderate exercise for at least 30 minutes daily. Increasing physical activity. Exercise. Short-term exercise, doing simple warm-ups for 2 minutes every half an hour, whenever time and privacy permits, improves physical fitness. Exercise is a topic for another upcoming video in this Prescribon medical education series. Exercise improves muscle blood flow. Exercise decreases cardiovascular events. Exercise must therefore be encouraged in all patients, but the advice must be realistic, achievable, and safe. Brisk walking for 30 to 40 minutes every day is better physiologically than a hectic workout in the gym once or twice a week and is within almost everyone's reach. Instead of quietly sitting in front of television, do simple body exercises while watching TV. Every 2 hours you spend watching TV instead of pursuing something more active increases the chances of developing diabetes by 20%. It also increases the risk of heart disease by 15% and early death by 13%. The more television people watch, the more likely they are to be overweight or obese. And this seems to explain part of the TV viewing diabetes link. The unhealthy diet patterns associated with TV watching, that is, uncontrolled eating of high calorie foods, may also explain some of this relationship. Patients at risk: those who have blood pressure, heart problems, diabetes, and other diseases must be examined by a doctor, should have an ECG with consideration for an exercise tolerance test and echocardiography, and appropriate treatment for ischemic heart disease or heart failure before starting exercise. Exercise remains beneficial and important in these cases, but should be built up more gradually. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital e-prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Tobacco. Tobacco use is the most preventable cause of death in the world. More than 1.3 billion people use tobacco worldwide. 5.8 trillion cigarettes smoked globally in 2014. More than 80% use occurred in low and middle income countries. The use of tobacco products among children and women is increasing. If current trends continue unabated, tobacco will cause more than 1 billion deaths during the 21st century. Some of the highest tobacco use now occurs in the Eastern and Pacific region. Cigarette use is directly related to myocardial infarction, that is MI, heart attack, increased rates of sudden death, aortic aneurysm formation. Aorta is the largest blood vessel arising from the heart, having localized dilatation of its vessel wall, that is the aortic aneurysm, and peripheral arterial disease of limbs, especially lower limbs, intracranial hemorrhage, that is brain bleeds, that is bleeding between the brain tissue and skull or within the brain tissue itself. They can cause brain damage and be life-threatening. Some symptoms include headache, nausea and vomiting, or sudden tingling, weakness, numbness, or paralysis of face, arm or leg, and subarachnoid hemorrhage. That is, a subarachnoid hemorrhage is bleeding in the space between the brain and the surrounding membrane, that is the subarachnoid space. The primary symptom is a sudden severe headache. Smoking. Smoking increases blood pressure, contracts blood vessels, that is narrowing of blood vessel walls, contributes to blood clot formation, that is thrombosis in atheromatous plaques, increases the tendency for coronary artery direct constriction, that is coronary spasm, increased tendency for irregular beating of heart, that is ventricular arrhythmias, and it is also responsible for insulin resistance, which in turn is a causative factor for atherosclerosis. Smokers, on an average, lose about 10 years of their expected life. Smoking increases the risk of oral contraceptives, causing premature coronary heart disease, stroke, and venous thromboembolism, that is, obstruction of a blood vessel by a blood clot that has become dislodged from another site in the circulation. Secondhand smoke also contributes to coronary heart disease. Secondhand smoke is smoke from burning tobacco products like cigarettes, cigars, hookahs, or pipes, and smoke that has been exhaled or breathed out by the persons smoking. In 2011, approximately 600,000 non-smokers died as a consequence of exposure to secondhand smoke. Smoking greatly amplifies macrovascular, that is bigger blood vessel risk. Smoking may also accelerate the progression of nephropathy, that is kidney disease, and possibly retinopathy, that is eye screen called retina, that is its disease. Many people, especially young women, continue to smoke as a means of keeping thin and because they fear gaining weight if they stop smoking. Nicotine reduces fondness for sweet, energy-dense foods and may also be mildly thermogenic, that is increasing body temperature and hence burning up of body calories. Weight gain after stopping smoking averages 3 kilograms, but in about 20% of cases, the gain is more than 6 kilograms. The risk of continuing to smoke are much greater than the degree of weight gain if smoking is stopped. Pharmacological support to overcome nicotine dependence, including the use of nicotine replacement antidepressants like bupropion, nortriptyline, and other drugs, increases the chance of quitting smoking by around 2 to 3 fold. Electronic cigarettes, that is e-cigarettes, are battery-powered devices with cartridges that contain nicotine, flavors, and other chemicals which are inhaled as a vapor. These are a popular substitute for smoking as they are cheaper, widely available, and probably less harmful than cigarette smoking. However, there are concerns about their long-term safety as clinical trials to ascertain safety have not been performed. There are also concerns that the sweet flavors and bright colors may encourage children to use the products and develop a nicotine addiction. Environmental exposures. Environmental pollution, that is, exposure to particulate matter, air pollution, that is dust, dirt, soot and smoke, heavy metals, example cadmium, arsenic, lead and mercury, and polyaromatic hydrocarbons like coal, crude oil, petrol and diesel. All are associated with increased risk of mortality and morbidity for cardiovascular diseases, CVD. Air pollution causes 7 million premature deaths annually, majority occurring in India and China. More than half of all deaths associated with air pollution exposure are through cardiovascular and cerebrovascular diseases involving ischemic heart disease, that is IHD, heart failure, stroke and hypertension. These occur mainly by particulate matter entering lungs provoking inflammation, causing thrombosis, endothelial malfunction and atherosclerosis. 2. Particulate matter entering lungs causing autonomic nervous system imbalances, causing hypertension, endothelial malfunction, constriction of blood vessels and atherosclerosis. Alcohol. Countless scientific studies have encouraged the idea that a glass of red wine a day can be good for the heart. Unfortunately, this is not true at all. The safest level of drinking is none. This zero level is in conflict with most health guidelines which espouse health benefits associated with consuming up to 2 drinks per day. Moderate drinking may safeguard people against heart disease, but the potential to develop diseases, driving accidents, self-harm and cancer greatly offsets these benefits. About 5% of cancers are linked to alcohol. Alcohol led to 2.8 million deaths in 2016. It was the leading risk factor for diseases worldwide. The more people drink, the higher their risk of alcohol-related health problems. Present so-called recommendations. Alcohol contains 7 calories per gram. Beers and wines, in particular, can be fattening. Intake should not exceed 3 units, that is 30 gram per day in men, and 2 units, 20 gram per day in women, and should be further limited or avoided in those with hypertension or obesity. Diabetic beers, that is low in sugar but strong in alcohol, and spirits with sugar-free mixers are especially likely to provoke hypoglycemia. Medicines. Medicines that may be used to treat atherosclerosis include antiplatelet medicines. These are medicines used to decrease the ability of platelets in the blood to stick together and cause clots. Aspirin and clopidogrel are examples of antiplatelet medicines. Aspirin therapy. Aspirin provides substantial benefit for those atherosclerosis patients who have existing cardiovascular disease at a dose of 75 mg per day. If there is aspirin allergy or intolerance, antiplatelet agents such as clopidogrel are given. If there is no cardiovascular disease, the role of aspirin primarily for atherosclerosis is not well established. Anticoagulants, also called blood thinners, these medicines decrease the ability of the blood to clot. Warfarin and heparin are examples of anticoagulants. Cholesterol lowering medicines. These are medicines used to lower fats, that is lipids in the blood, particularly low density lipid, that is LDL cholesterol. Statins are a group of cholesterol lowering medicines. They include simvastatin, atorvastatin and pravastatin among others. Blood pressure medicines. Several different groups of medicines act in different ways to lower blood pressure. Coronary Angioplasty. With this procedure, a long, thin tube catheter is threaded through a blood vessel to the heart. There, a balloon is inflated to create a bigger opening in the vessel to increase blood flow. Although angioplasty is done in other blood vessels elsewhere in the body, percutaneous coronary intervention, that is PCI, refers to angioplasty in the coronary arteries to permit more blood flow into the heart. There are several types of PCI procedures, including 1. Balloon angioplasty. That is, a small balloon is inflated inside the blocked artery to open the blocked area. 2. Coronary artery stent. A tiny mesh of coil is expanded inside the blocked artery to open the blocked area and is left in place to keep the artery open. Coronary artery bypass. Most commonly, this is referred to as bypass surgery. This surgery is often done in people who have angina, that is chest pain, due to coronary artery disease, where atheromatous plaque is present. During the surgery, a bypass is created by grafting a piece of a healthy vein from elsewhere in the body and attaching it above and below the blocked area of a coronary artery. This lets blood flow around the blockage. Veins are usually taken from the leg or from the chest wall. Sometimes more than one artery needs to be bypassed during the same surgery. Therapy for hypertension. Angiotensin converting enzyme inhibitors, that is ACE inhibitors. Angiotensin receptor blockers, that is ARBs, if ACE inhibitors are not tolerated. Calcium channel blockers or thiazide type diuretics are the first line agents. Therapy to lower LDL cholesterol. An earnest attempt at dietary measures, exercise and weight reduction should be tried. If these measures fail, then additional drug therapy should be prescribed. Usual drugs given are statins. They can have adverse effects such as muscle pain and tendency to develop diabetes. Drugs to increase HDL cholesterol. At present, such drugs are not available. Dear listeners, this is the end of discussion of atherosclerosis.